And then you have adductor pollicis, so that's going to be moving in like this. So that's going to be more in this part here. So actually it's cut away, so it'd be right here. So it's coming across this way. That's going to be pretty much right here. And then you have abductor digiti minimi, which is going to be on this side here. Okay, so that's going to pull the finger away from the midline. And that's going to be this one right here. So you can see as this contracts, it's going to pull the little finger over that one. And then flexor digiti minimi brevis. Going to be here, so if it's going to do flexion, it's going to be on the anterior surface here, so it's just pulling back like that. So it's going to go from here to here and flex the finger like that. So it's the medial side of the proximal phalanx of the little finger. So the ones that go farther into the distal part of the fingers are muscles that come from the forearm. The ones that are in the hand are usually going to go more towards the proximal part of the fingers. And then ponens digiti minimi. So that's from the pisiform and the transverse carpal ligament. And then the medial side of the fifth. That's going to be here. So it's underneath that flexor digiti minimi. And so it has a little bit more of an angle like that because it's going to do opposition, which is bringing the thumb and the finger together. All right, then now we're getting down deep into the actual space in between the metacarpals. And so you have the interossei muscle. So you have a palmar interossei, and then you're going to have dorsal interossei. And so then what the palmar interossei is going to do is going to bring, when you're talking about abduction and adduction in the hand, you're using the middle finger as the reference. So everything that's adduction is bringing them towards the middle finger. And then abduction is moving away from the middle finger. Okay, so this is going to be adduction, and then this is going to be abduction. Okay? And I'm not sure what, when you're talking about the middle finger, I guess it would only be abduction either way. Right? You can't adduct it onto itself, so it only goes side like that. And then what muscle is this?
Prosper.
That's something else. Okay, so then the dorsal interossei, those are going to be more towards this side, but it's right in between the metacarpals. So then what those are going to do is going to be to abduct the fingers. So that's going to pull this one this way, this one, and then the middle finger is going to pull on either side. As you can see, it has some on this side and some on that side. So abduction of the middle finger is going either way like that. Okay? So these are the dorsal interossei that move away from the middle finger, and then the palmar interossei move towards the middle finger. Right. It doesn't do anything to the middle finger. Okay? So the palmar interossei are on the, sometimes on the lateral side, sometimes on the medial side of the finger. They're the palmar interossei are on the side of the fingers closest to the middle finger. So it would be here and here and there. And then on the dorsal side, there's two on the middle finger, and then one on each of the other ones. On that side opposite the middle finger. But like I say, I mean, these muscles are not really going to come up that much. There's some, get into the, when we talk about the lumbricals, that comes up a little bit in terms of joint problems in the hand. Okay, anybody have any questions? You know, there's a whole bunch of muscles, right? But if you just kind of keep them in different groups, you have the general concept is that extensors, wrist and hand, and they're more on the posterior surface and the lateral epicondyle. Then you have the medial epicondyle, which is going to be more of the flexors. Okay? And then, we'll take a break and we'll do some palpation and more, like some muscle testing and identify all these different muscles. But basically, with all the material that we're going to cover for today, we're just going to go over it in different ways. Okay? So, if anybody didn't